A lot of us did feel that we was getting ready to go to war, and we was thinking, this is it, what are we going to do?
Staff members being in tears, breaking down.
Everything just hit sort of at once.
The problem with this pandemic is that it's not something that's there and then just disappears the next day.
When you come to work, you just worry what you're going to take back to your family.
Everybody was affected. I don't think there's anybody who went through this that hasn't been affected in some way.
Catastrophe brings change, and some of that change has been good.
You just want people to, to be able to hold her and give her a good squeeze.
This hospital will never be the same again, and nor will the NHS.
People came together like a family.
I'm a midwife.
I'm a theatre nurse.
I'm an emergency physician.
I have been delivering babies.
I've been treating cancer patients.
Through the COVID-19
pandemic.
Professor Kiran Patel is performing emergency surgery.
Little scratch coming up, just a little needle going into the skin.
Lying on the operating table is 39-year-old Adam Weston. He was found collapsed on a street and has been rushed to hospital. Adam suffered a cardiac arrest and is having a defibrillator fitted inside his chest. Professor Patel would have carried out a procedure like this possibly hundreds of times before, but there's something very different about this operation. This is surgery carried out during a pandemic. Emergency operations had to continue through the pandemic, even as the hospital struggled to deal with the greatest health crisis to hit the NHS. Professor Patel has not had a day off since February.
Phase 1 and 2, where we were preparing for the pandemic, we would have probably 2 or 3 weeks. That turned into 2 or 3 days, actually. So the pace of change was quite remarkable. And we saw change in the NHS that happened over the course of days and weeks that would otherwise have taken years to happen.
That's a good lesson to take forward, isn't it? What happens now for the future of Coventry Hospital, for the future of the NHS?
We're certainly not going back to where we were. This will be a new normal. And in fact, one of the things we learn is that we don't just stop when we achieve something, we continue to improve.
When I come in, I didn't know nothing. I didn't know I'd been in the critical bit. I didn't know I'd been dead or nothing. So it was all a shock to me.
Now you're ready to go home?
Yeah, now I'm ready to go home.
University Hospital Coventry lost 253 patients to COVID-19. More than 500 people infected with the virus were treated and sent back to their homes. During the crisis, more than 4,000 operations were carried out. The 9,000 staff who work here are the hospital's lifeblood. They have learned, adapted and changed to function in a COVID world. At the height of this pandemic, this hospital was dealing with hundreds of COVID-19 patients. Now, there are only 4 left. "6,000 babies are delivered here every year. The hospital had to prepare for these new arrivals, pandemic or not. Expectant mother Tanya followed developments with increasing anxiety.
Especially not having my partner here throughout the whole thing was quite scary. So I spent quite a lot of it on my own in the ward whilst having contractions, and then you get the anxiety that what if he doesn't get here in time for the actual birth. They allowed us to have as much time as possible together with the baby, and then he hasn't been able to see her since, so it's a bit, going from top of the world to actually then not being able to see his daughter.
When she's a little older, and you'll be able to tell her some of the stories about being born during a pandemic.
I know, yeah. Well, I think it'd be something she'll probably be learning in history class at school. Yeah, I don't think she'll quite believe it. Well, I can't quite believe it, to be honest.
So let me show you this theatre. This is normally called a twin theatre. This is theatre 1.
The fear of COVID-19 was not limited to new mums like Tanya, but spread to the medical teams delivering their babies.
Although we're doctors here, but you have a family back home, and I think when you come to work, you just worry what you're going to take back to your family. I have 2 children. It was quite scary at the beginning.
These concerns were shared across the hospital, especially by staff redeployed to the intensive care units.
A lot of us did feel that we was getting ready to go to war, and we was thinking, this is it, what are we going to do?
Staff members being reduced to tears because they're so worried about their families, about what they're taking home with them.
I don't think there's anybody who went through this that hasn't been affected in some way, but I think, I just think I feel personally quite proud of what we've achieved and the team.
You wish you could have done more, even though there's nothing that you could do. It's upsetting. You end up bottling it up as well because you've just got to go on to the next one and then the next one.
It was sink or swim. I had to just get on with it, and I had to just do it because this is what I do.
We are used to unfortunate things happening. This was happening on an unprecedented level.
And suddenly these patients were just disappearing, and it almost got to the stage where you didn't want to ask whether they'd got better and gone to a ward.
I'm used to death, but not when you've had someone breathing next to you sort of a couple of hours beforehand and the next minute they're dead.
It is the loneliness of dying with COVID that has affected staff the most. Doctors, nurses, and those tasked with the responsibility of comforting the bereaved. At the peak of the pandemic, the hospital's mortuary was in danger of being overwhelmed. The hospital coped, but the heartbreak of forced isolation has taken its toll.
Overwhelming, very overwhelming. Whilst you're in it, I found every day I was coming into work, just not knowing what to expect. And it's sort of like adrenaline from when you first come in, like you just don't know where your day's going, and then it's only when you manage to go home, you can sort of reflect on your day. I think during the whole thing, the hardest time or points have been they limited viewings on all the wards for families. So we had to do the same down here. So we did occasionally get families calling that wanted to come and see their loved ones, and we weren't able to always do that for them. So that was quite hard.
How are you feeling?
Less stressed, which is a good thing, but I think we're all still very anxious just in case we do get a second peak, just to see what happens.
The threat of a second wave hangs over the hospital's emergency department. It's one of the busiest in the country, but the fear of COVID has kept patients away.
Initially had chest pain, 10 out of 10, dropped onto the floor.
Now, with lockdown easing and the pubs and bars reopening, ED is getting busier. Gary is back in hospital. He's been struggling to walk because of breathing problems. For emergency consultant Dr. Ali Hussain, the uptick is welcomed. The missing patients were a worry. And it's challenging. We are still in the grip of a pandemic.
The problem is that COVID is going to stay around for a long time, and it's now trying to balance how we go back to what we had before whilst maintaining what we've tried to sort of institute for it. So it's a bit of a juggling act, to be honest with you. Before we were dealing with just AD patients, and that was fine. Then we changed the way that we worked and we were dealing with just COVID patients. Now we're going to have to try and marry the two together.
Leicester, the site of a localised outbreak, is not far from here. Staff have barely recovered from the first outbreak, and they know a second wave is possible.
We as a hospital have responded very well to the first wave, and I've been very happy with how we've been able to cope. So as bad as it will be, having gone through the first wave almost like a trial run, I think I'm quite confident that we'll be able to handle it.
The emergency department has undergone significant change. The waiting room has gone. Walk-in patients are triaged before they get inside the hospital. There are new systems in place designed to keep the hospital COVID-free to protect patients and staff. Wherever you look in this hospital, you will see transformation, forced change because of the coronavirus pandemic. This hospital will never be the same again, and nor will the NHS.
Take your temperature.
The real change is not so visible. COVID-19 has demanded a flexibility rarely seen in an organisation this size. Red tape was slashed, allowing decisions to be taken quickly, for new technologies to be adopted and implemented. The scale and pace of change, unthinkable pre-COVID.
I think there are lessons to learn, as I say there are for this hospital, there will be for the nation, and I'd like us to learn them in a non-blame way. The NHS for too long has been a place where if it wasn't invented here, we don't do it. None of that anymore. This is about who does things the best, who can we learn from, how can we bring it into our hospitals.
Tanya has been told she can go home.
Come on then, you.
It's time for baby Sophia to be reunited with Dad James. You said this is going to be your first night as a family together.
First night as a three, yeah.
When she is old enough, Sophia will learn about a pandemic, the dedication of medical workers, and a National Health Service that was forced to change.